Being a new ICU nurse can be very challenging. There's like a lot of new terminology you probably haven't heard of. Some strong personalities from the staff, a lot of noise all over the place, and it can be very nerve-wracking to be in such an environment. So to help you out, I'm gonna give you my top 10 tips to help make your transition into the ICU just a little bit more smoother. Hey, this is Thomas from Nurse Money Talk, where I help nursing students become nurses and nurses excel in their nurse career and their nurse life. And in this particular video, I'm going to give you some tips. Some 10 tips, actually, 10 of my top tips to help you navigate kind of like the first few, if you want to say months or first like year of just being new into the ICU environment. Before I get started, don't forget to hit that thumbs up and that subscribe button so you do not miss any of my new videos that are coming out. My first tip for new ICU nurses is to make sure that you seek out a good preceptor. I would probably venture to say that in most situations, you're probably not really picking out like which nurse is going to be your preceptor. And so that's typically going to be done by the manager of whatever unit that you're walking into. But even if like it's being picked out for you, that doesn't change the fact that the preceptor that you have really does make a huge difference in what your nursing practice is going to be like. Especially if you are like a legit new grad nurse, like you've never had a nursing job before and this is your first job. Like, you know, if you get a good nurse preceptor, they really do shape what you're gonna do. A good one will kind of teach you the good habits, like help you form good habits, help you form your own good rhythm in what you're gonna do. Like a good preceptor could potentially turn into like a mentor as well if you guys really connect. To me, like the difference with that is that you kind of move to this point where you're eventually gonna, kind of get past the preceptor stage where you're out of, orientation. They end up being somebody who you could potentially go back to for any issues, any questions you might have, any follow-ups or anything like that. A good preceptor is going to teach you, the rules, the guidelines of the facility, but even not just the written rules, but they're going to also teach you the unwritten rules. So, for example, they're going to teach you the, maybe like this is who's a good resource for X, Y, and Z. This is a doctor that's a pain in the butt. This is how you talk to this particular doctor. This is how, this particular manager's whatever. So they're going to teach you the informal things. And to me, personally, the informal stuff is just as important as the more formal, established things as well. Typically, and I do have a video on just kind of like how to deal with a difficult nurse preceptor that I'll have linked above. But just kind of give it a quick little summary. Like if you run into a situation where you're struggling with your preceptor, they're either not very good or you just don't really click, it might be worth it to you to talk to your nurse manager about it. And the reason why I phrase it like that is that I do understand that at times it's kind of difficult. I know the issues I've had with like if I have a preceptor and I don't connect with them is like, man, I don't want to talk to the manager because if I talk to the manager, and even if they do find me a new one, then I get like singled out and, maybe like that person might hold a grudge or that might not be able to come to them for help later. I'm not sure I have a good answer for that. I think it's one of those things where like, if that's where you really want to be at and you really want to get proficient at that craft, it might really be worth it to you to have that discussion with your nurse manager, even if you end up deciding not to do anything as well. That, or like if you do have a bad preceptor, like maybe if you find somebody else who you connect with that's just a better nurse in general, then maybe you can help, that person can help you bridge that gap. I have had that situation where this is the person that precepted me, but this is the nurse that I was actually going to for resource and for help and for guidance. So it's not the cleanest thing, but it is something to kind of keep in mind of. The second thing to think about is to come with a teachable mentality. If you are a new grad nurse, you definitely sure the heck don't know anything. If you are a new, a nurse with experience, but you're coming to the ICU, even if you've had all these experiences, you need to remember that you are in a new specialty. You are in a specialty with potentially different lingo, with potentially different ways of doing things. So you just really have to keep that in mind and make sure you come ready and willing to just be able to just learn and soak up information that's being taught to you. I mean, from experience, it's annoying trying to teach an orientee something and they think they know it all, which is very frustrating from the preceptor standpoint, especially when you're acting like you know it all and I'm looking at you like what you're doing is wrong. Like it is flat wrong, and there's guidelines that I can literally pull up from the hospital that says what you're doing is wrong. The third tip I would give is to just start learning common ICU nursing principles, terminologies, and just kind of like stuff like that before work and after work, so in a situation where start learning about vents. So you don't necessarily have to wait for orientation to start reading it up. There's a lot of helpful materials out there that you can start learning about vents. You can start learning about drips, some of the medications that you're gonna give. I mean, so there's a lot of things you can do to really start educating yourself and to really take initiative in your learning. I'll put a link in the descriptions below of where you can go to kind of check out some good learning materials or some resources for kind of learning the ropes of the ICU. My fourth tip is to pay attention to your extra certification. So this would be, for example, your ACLS, your PALS, your BLS. This would go under the same realm of paying attention to when your license expires. Typically speaking, you can't work if these certifications are expired. You can potentially get written up in extreme circumstances, maybe get fired, but probably at minimum get written up. Even if that doesn't happen, you're off the schedule, you're not working, you're not making money. So, I mean, that's just some stuff to keep in mind as well. I did have a video that I filmed, and I'll put that up top, of just kind of some of the things that can get a nurse at a minimum written up, if not fired. And this one definitely made my list, so you can go check out that video if you're interested. But for sure, keep tabs on your certifications and licensures. So you can definitely, what I do for it is that I'll set reminders on my phone, on my calendar. So it'll start giving me reminders maybe, a couple months before, several months before, it'll start giving me routine reminders as well. You can try to trust your system for, your hospital facility system for reminders for stuff like that. I personally wouldn't. The certifications that, to me personally, I need to have to make money, to work, to do my job. So for example, your nursing licensure, your ACLS, BLS, your PALS, stuff like that where if you don't have it, you're not gonna be on the schedule. I like to keep tabs on that myself. Anything else random stuff, maybe if it's some educational online whatever that your facility might have that's unique to them, you can you can maybe keep tabs on that or let their system worry about that. I wouldn't be too concerned about that. It's just like the important ones, like kind of like on the realm of that I mentioned. Those are the ones you need to keep tabs of. Number 5 is I would always recommend ask questions. There's really no such thing as a dumb question. There are such things as you doing dumb things because you didn't ask a question that you should have asked. So it's always important, ask questions. If you don't know, ask questions. You are in an environment where there's a lot of high acuity patients. There are very sick patients. There are decisions being made that have life and death consequences. So you need to make sure that what you're doing is up to par. So if you're even remotely questioning what you're doing, ask questions. Number 6 is try to get a routine going. And that is, what is your rhythm? What are you gonna do first thing when you walk in? Second thing, third thing, like this is how you're going to get yourself organized so that tasks can get done faster, and put you in a situation where you are a lot less likely to forget things. So this is something that doesn't happen overnight, but it's a gradual step, and a good preceptor will help you solidify your routines and your rhythm. So for example, what am I going to do when I walk on the unit? What am I going to do before getting report on my patients? After getting report, when are you going to assess your patients? What's that rhythm going? What are those rhythms are going to be like? How are you going to pass your meds? Your charting? What are the flow of your charting going to be like? These are things that, as I'm saying it, they seem kind of like, well, that's not really that big of a deal, but it kind of is. And it's not, it's in the sense of like, you're going to get and form your own rhythm as you just work. That a lot of it is just time. But some of these things that I've listed out, like when you go on the unit, look at what some of the nurses are doing. And what you'll realize is that there are different nurses are doing things at different steps. Not necessarily wrong, because there's there's right ways to do things so if you have like a destination, a point that you're getting to, if you're trying to get up here, at times there's different routes you can get to get to there. It might not even necessarily be the quote unquote quickest way, but it might work. I mean, if it works for you and it's not committing harm to a patient or to whatever, it's not breaking any facility guidelines, what difference does it make, I've looked at a lot of nurses, and one of the things that I've noticed about, especially like experienced nurses as well, is that like a lot of, nurses will actually have like, there are certain things that they'll do really, they'll do the quickest way, the quickest, most efficient way. And then there'll be certain things that they'll do that you'll sit there and you'll think to yourself, that's not like, that makes no sense at all why they're doing it like that. If it works for them, it works for them. So number 7 is stop thinking about the NCLEX. Just stop. NCLEX world is over with. You are in the real world. And what I mean by that is that you're in the real world. I mean, I don't know how else to say it, and I think every seasoned nurse will agree with me that there is a huge difference between what is done in textbook and what's actually done in real life. There's a difference between what's done in an ideal world where the patient ratio is like perfect and all this other stuff. And then there's things that, there's ways to do things in the real world where like, it should only be 1 to 5 patients, but yet I have 1 to 8 or something like that. So, of course, the goal is to do things, based on evidence-based practice, based on facility guidelines and yada, yada, yada. But at the same time, I'll just say you do have to remember that you are in a real world setting and you are no longer in the NCLEX world. Number 8, and this goes along with the first thing I said, which is about finding a good preceptor, is try to find a mentor. And in an ideal scenario, your preceptor will become your mentor. But your mentor is somebody who like you can lean on. Like if you have questions, your go-to person. I mean, especially if you're like a new grad nurse, like fresh from nursing school, like it's really nice to have that somebody who you can rely on for like your first year or two or something like that in that you're out in the workplace. It's hard to come by, but it can be done. Number 9 is form friendships, or at least try to form friendships. This isn't saying that, and I'm not trying to say like you need to be buddy friends, go out to dinner party or whatever with everybody you work with. But I think for the most part, like it really helps to be cordial with the people or most of the people that you work with. It helps to take an interest in at least some of the people that you work with. That's where you get to form those relationships, potentially find a mentor, have somebody who, like, when I'm drowning and I'm struggling, I got somebody there who's going to have my back. Because here's the thing, you're going to need backup. If you're a new, like a new grad nurse, like rolling into the ICU, you sure the heck will need some backup. You're gonna need some help. If you're a nurse that has experience rolling into the ICU, you're going to need backup. If you're an ICU nurse that has experience that's going into the ICU, you're going to need backup. You're going to need help. Having somebody who can help you in situations that are just going tough is important. Number 10 is finding ways to manage your stress. Nurse burnout is a real deal. The ICU is a stressful situation. I mean, you're gonna find ways to. I mean, you just gotta find ways to de-stress. You're gonna see a lot of people hurting. You're gonna see potentially where you're at. You're gonna see potentially a lot of deaths. You're gonna be in situations where like you will do everything right imaginable and the patient still passes. And so you're gonna have to learn how to deal with that, how to not carry that home with you. We do have a video on managing your stress as a nurse. You'll see it up there, or I'll link it in the descriptions below. And so I can't really push it enough just to try to manage your stress. I actually think originally I said 10. Now that I'm thinking about it, there's actually some other things that I would actually like to mention. So it's gonna actually be more than 10. So number 11 is being mindful of ICU nurse personality. From my experience, ICU nurses have, how do I say this? They have their own different set of personalities, especially like if you work in a very like specialized ICU setting. They tend to have certain characteristics, not all, but you're looking at very assertiveness, detail oriented, sometimes bossy. And I think a lot of that, it just comes with the nature of the job, because like if you look at the situations where you're at and very specialized, like cardiac transplant, neuro, whole 9 yards, there's a lot at stake. And you have to go out there, like you're the one dealing with the patients. You have to go out there and you have to advocate for your patients. You have to keep tabs on what the techs are doing, if you have them. And so there's a lot going on. You have to deal with, you tend to have to deal with very like potentially some temperamental doctors as well. And so it's just kind of like some things to really just kind of keep in mind of the personality of ICU nurses. Number 12 that I'd have to say is like being careful about not working crazy hours. And the reason why I bring this up is like, this is probably specifically for the brand new nurses, but you can, especially once you get out of orientation, if you can work 60, 70 hours, they probably let you. I would just be very careful of working so many hours and burning yourself out on that. I would definitely try to ease in there, know when to take breaks, know when to actually, be able to go out and spend some of that money that you're going out and making. And that's weird that I'm saying that, because that's actually coming from somebody who's a saver. But anyway, my point being that you really do have to know what your limits are. The last thing I'm gonna mention is, and this kind of encompasses all of it, and that is Know when to be your own advocate, which should be every single time. Like every single time, every single day, you gotta know when to advocate for yourself when it comes to dealing with doctors, dealing with other nurses, potentially some nurse bullying, dealing with a preceptor that's not very good. You know, the list just goes on and on. Know when to advocate for yourself. And that's also knowing when to advocate for yourself when it comes to even for yourself. You got to know when to take care of yourself. When do you need to take a step back, chill, go on vacation, do whatever. And so to make sure that you are managing your health, managing your stress, managing your work-life balance, so you can have a prolonged career. Nursing is an awesome career. There's a lot of opportunities there, but I think to be able to take full advantage of this excellent career, you've got to be able to truly advocate for yourself. So that is actually all I have for this particular video. Thank you so much for watching this video. Let me know in the comment sections below if you have any questions at all, and I will catch you very soon in that next video.